The reality is, I tell people, we have one ass, we have one sex life. If you are wired to take it up the ass, the reality is that you should be able to. And nowadays we have ways to allow people to get there. There's so much need in the community to really understand sexual wellness, have a place that's safe so that people can explore what they want. I have the surgical tools to actually provide people with that. I was studying heart surgery. I was married to a woman. I wasn't out at the time. And I started to realize that I wasn't happy. If you and I went down the streets of London, we could swab 10 random guys and you and I would know who takes it up the ass.
Okay.
And the reason is because the bacteria changes from anal sex, from douching with water, from using water-based lubes, because I think the shaming adds so much more to the fear and the stigma. We are engaging in anal play, and at some point in all of our lives, there will be a mess in some capacity. Because 75% of the world, 75% of bottoms can't bottom comfortably. 75%.
Wow.
Well, nobody ever stretches their asshole. And think about 99.9% of the day, your ass is clenched and tight. I always say the best tops in the world are bottoms because they're able to actually understand the mechanisms of how to enter.
Hi, I'm Azamat.
And I'm Oliver, and we're the founders of Friend of Dorothy.
In today's episode, we're having Evan Goldstein, founder of Bespoke Surgical, co-founder of the Future Method, and so-called butt doctor. Hi, Evan. How are you doing?
Thanks for having me.
Hi, Evan. Great to have you on.
Butt doctor, how do you live with that? How does it make you feel, Evan?
On the inside.
Well, on the inside, it tickles me pink. I'll tell you that much. But on the outside, it's actually amazing. We change people's lives, and with the practice Bespoke Surgical, I never thought I would be doing what I'm doing today. But with that being said, there's so much need in the community to really understand sexual wellness and bridge science into sex and have a place that's safe so that people can explore what they want and be able to do that. And I have the surgical tools to actually provide people with that, which is amazing. It's such a cool thing.
Yeah. And on top of that, you have the Future Method, which is non-surgical. So you're covering it all, right?
Yeah. It kind of really bred, per se, out of Bespoke Surgical. When I was doing all of the surgical and medical evaluations, I started to see very common ailments, issues that people would come to me with, where when you're asking them questions, you would find out that they're using products that are not substantiated for anal sex, whether it's douching and cleaning, which toys they're using, etc. And so I was like, well, wait a second, why don't these products exist that are bridging that science and sex component? They didn't at that time, and that was really the birth of Future Method. And the reason I think why we're even having this conversation is because we're going international. Well, we turned on the international component of the brand, which is really amazing because now the whole world can
Evan, can I just back up a little? I'm just super interested. I think your brands are amazing. I've seen them since we set up our brand, and I've always been in awe of them. But how did you get there?
So I think it's a great question. I think this really started more from me. I was studying heart surgery. I was married to a woman. I wasn't out at the time. And I started to realize that I wasn't happy. I wound up meeting Andy, my partner. We've been together 20 years and 2 kids later. And I started to engage anally myself, where I was like, well, wait a second, things aren't working. Well, where do people go in the community for help? And it was like right at that time where HIV was really just a chronic disease. And now people were living, people were aging, our community was growing older, and people were having a lot of issues where I started to say, wait a second, I'm having these issues. Where do people go? And the answer is nobody would go anywhere. It didn't exist. So I said, okay, why don't I start? And I met a lot of primary care doctors in the gay space to really think this out fully, to say, well, how can I help you and help the community? And you're right, nobody taught me how to do this. I kind of bridged my plastic surgical training with colorectal training and said, okay, let's just try and figure out, how does it heal? How does it look good? How does it become functional? How do we get people to run-of-the-mill sex or fisting or huge toys? You start to kind of understand the community when you're geared towards it, and then you're able to really target treatment approaches. And it's been, it's life-changing for so many people.
And how long have you been doing it now?
Yeah, about 15 years. I see about 90 people a week. A lot of times I see people from the UK and out of the country, just because these services don't get provided the way that they do in our service. The reality is that it's mostly white, old men that are straight that do not understand the sexual nature of what we're trying to achieve.
Of course.
And the reality is, I tell people, we have one ass, we have one sex life. And if you are wired to take it up the ass, the reality is that you should be able to. And nowadays we have ways to allow people to get there.
I hear you're known for a famous quote, take dick all the time.
Yes. You can, if you want to take dick all the time, you can.
Take dick all the time. So I think we've sort of raced along there. So obviously you have two brands. Could you describe exactly what it is they do for us?
Sure. So Bespoke Surgical is basically the medical and surgical approach. So many people that come to the office are coming to me because they're having an issue, a functional issue. I'm trying to take my partner and I can't, or I'm having sex and there's pain, or I'm bleeding, or there's some limitation physically, neurologically, and or mentally. So that's really the medical side of the brand. Now, in that, I have aesthetic services. So some people come where they have extra skin. Some people, the skin is too soft or they want bleaching. So there's lots of things that we could do kind of on the aesthetic side. On the functional side, I have a physical therapist, and we understand kind of the anatomy, and we're understanding what type of muscle structure and pelvis do you have. And I always break things up on the surgical side of 3 different buckets. Bucket 1 is, can you do things on your own at home with proper education, proper products, proper understanding of your anatomy? That's kind of bucket 1. Bucket 2 is, do you need me to do things in the office, like physical therapy, like anal Botox, which I'm sure we can talk a lot about. All those things kind of in the office to get you to where you need to be. No pain, no bleeding, and good sex. Or do I need to do surgery? That's bucket 3, where you have a hemorrhoid, or you have a fissure, a tear, or extra skin, or you're too tight that I need to cut muscle. So that's kind of the surgical brand of people's engagement. So that's Bespoke Surgical.
Yeah.
And then what kind of grew from that was Future Method brand, which was, how do we look at douching and how do we douche correctly? We know water and we know enemas are really bad for the microbiome. People have a higher incidence of STDs, a higher incidence of HIV. People are over-douching. And when they're over-douching and cleaning, they're having injuries and issues. So we came up with a product basically that's like, a crystal light for your ass, which is basically to get you so that you're clean, but you're not fucking with the microbiome. You're not altering things. We came up with glass dilators that are sequentially getting you slowly into the groove. People feel like you can go from nothing to dick right away. And the reality is that many people can't, and you have to gradually dilate. And we have glass dilators, we have silicone, we have a cone that allows you to stretch the skin. We have pre and probiotics, the first ever pre and probiotic specifically for anal sex. So it replenishes the anal microbiome along with fiber. And so, like, all of these things in our space are geared towards bridging what I see in the office from Bespoke Surgical and putting the science into sex on a product side, so that if you're using products, if you have the education, if you have the wherewithal, you then don't need to see me in the office
Mhm.
because you're engaging the way that nobody ever taught us. So that's kind of the basis of where we are.
In the UK, there isn't anyone talking about this. There's probably a need for more education for gay men on this sort of thing. Would you agree?
Oh my God, 100%. I mean, that was really the impetus of me writing my book. It's called But Seriously.
I
And
love
it
it,
was all
but
ab-
seriously.
it was all yeah, it was all about that, which was I'm only one person in one location. And it's like, how do we start to really push this to the world? Which was first the education piece, and then obviously future method and kind of the product side of things. Thankfully, now there's the internet and there's, Google and Instagram and Facebook and all of these approaches where we now have education platforms that go directly to the patient, to the client, to allow people to really understand, because there's many people that have terrible first experiences and just say, fuck it, I'm not going to bottom, but yet really would enjoy it or would allow them to bring their partnerships that much closer, but they just don't understand which pelvis they have. They don't understand the right ways to slowly start to engage. And that's what really is, I think, going to be the game changer for so many people, which is to have that education before you start, so that when you're starting, you're able to navigate the pathways.
Yeah, 100%. We recently launched a series of posts which we called Bottom Academy. And actually, they got like the most engagement for the last year. People still are not quite educated about Basics 101.
That's
So,
right.
but again, just back to basics, square one. What would be your top 5 tips on how to prepare?
I think the first thing is, one, understanding and reading about anatomy, because I think if you understand the anatomical structure, you could start to really envision where we want you to go from a sexual perspective. So the ass is not overtly very complicated. It's two components. It's muscle and it's skin. Okay, that's basically what it is. And there's three sets of muscles in everybody's ass.
Hmm.
Okay, so if our listeners are squeezing their asshole, everybody squeeze your hole. You're squeezing the first two out of three. So the first two are what's considered superficial or external, and the third one is what's called internal. The internal sphincter is very thick. That is the one where, let's say I'm trying to top you and you're like, I'm relaxed and I can't get inside you because that third muscle, it's involuntary. It will not listen to you or I. And so when people are engaging, you need to understand the mechanism of how do we get all three of those muscles that are functioning independently of each other? How do we get them to open together in unison? And that takes time. And I'll go over that. The second is skin. So remember, we're asking the skin to open, but we're also asking the skin to absorb the pressure of sex. Now, sex is a higher pressure than pooping, than defecating. So the skin needs to be tough and it needs to be pliable. So again, when I'm thinking about, well, okay, I want to engage in anal, I always say, well, let's start with a glass dilator kit that has small, medium into larges, and it's about a 4-set kit.
Hmm.
Why do I like glass? Glass is weighted. It really engages that muscle, especially that third muscle. If you're using other toys, what happens is it doesn't stretch the rubber band of that muscle, which is what we're trying to do in a very controlled way.
Hmm.
Also, glass holds lube, whatever lube you're using. It really keeps it in that space so that you're decreasing the friction, you're decreasing the pressure, so that now the skin can open and accommodate. So I have a protocol, which is about 6 weeks of, I want to get into anal. How do I do it? And
Mm-hmm.
it's basically for the first 2 weeks, you will start with just the small dilator. And it's like going to the gym. I just need 2 days, 2 evenings of you doing this toy stuff where you'll do 2 to 3 sets of 15. It's just like going to the gym and doing biceps or triceps. And what you'll do is you'll turn the shower on, you'll do it in the bathroom, you'll stand up, you'll slowly go in until you hit that first muscle, you'll come back out. You'll relubricate. You'll go back in. You'll hit the first and the second muscle. And it may take you 5, 6, 7 times to get fully in past all three of those muscles. But as you're doing it, and as the listeners are listening, you start to understand, oh, okay, I get to see how I'm getting the rubber band to open a little bit. And you'll start to then engage the sets of 2 sets of 10, 2 sets of 15 only starts when you're fully in.
Mm-hmm.
So the toy goes fully in, and then it now will sit in the right space, stretching all three of those muscles, and you'll slowly go back and forth 3 to 4 centimeters, counting down 1, 2, 3. And by doing that, you are really starting to stretch the rubber band of the muscle and get the skin tougher.
Mm-hmm.
You'll always start with the small toy. You'll go from small into medium for the next 2 weeks, and you'll gradually progress through all the different phases. Now, during this, you need to say, am I having pain? Am I bleeding, right? We don't want pain. We don't want bleeding. You'll have some discomfort as you're starting to learn your anatomy, but it should progress very, very easily. If it's not, then you may be in what's called a group 2 or a group 3 pelvis, which we talk a lot in the book about what's called anal mediocris or anal nopus, which is like clearly group 3 is nothing's going in, it's painful from the beginning.
Mm-hmm.
Or group 2 is sometimes it can go in, sometimes I'm having pain. And so what do we navigate and what do we do in those situations? We can talk about in other questions. But I think, again, for people to understand, I do about 60% functional work, 40% neurological and psychological work. So when you're doing the
Mm-hmm.
toy stuff, it's also how do we get the brain to really understand pleasure? How do we get the brain to understand relaxation in a very comfortable way? And then how do we allow you psychologically to feel that pleasure, but look at your stigmas and your myths and your taboos and your psychological makeup of trying to get you into a really great space bottoming. So I know it's a lot, but I think that when you think about the mechanism of we need the ass to open and we need it to close. Well, what are the things that are restricting opening? Muscle, skin, and how it's connected to your brain.
Yeah.
And so by you working with these toys in a very gradual, progressive way, you can start to really understand your own makeup and what needs to be.
Mm-hmm. That's very interesting. I don't think I've ever thought about it in that methodology. What are the tips then for preparation, even for
Sure.
the toys, right?
So I don't want people to prepare at all for the
Mhm.
toys.
Mhm.
So when you talk about preparation, I'm assuming you're talking about, douching and
Yeah.
cleaning out. Yeah, we innately have so much stigma and phobia that you and I and all these people are douching and douching and douching, but we know douching is a problem.
Mhm.
So the key is how do you use the toys to show yourself that you are actually cleaner than you think? Now, let's take a step back. I want people to have the right bowel movements. So we talk a lot in Bespoke and Future Method, but seriously, we talk a lot about fiber, protein, appropriate diet, making sure that the bowel movements are compact and solid, but still soft.
Mhm.
So I think when you think about like preparation, I'm more of gut health versus butt health.
Mhm.
Though obviously I am a brand of butt health. I
Yeah.
think the key is, how do you eat correctly? How do you fiber supplement in the right way? Take prebiotics and set the stage so that you don't need to douche,
Mhm.
because we know that the douching leads to complications.
Mhm.
The area where we're having run-of-the-mill anal sex, if you're having the right bowel movements, is clean of stool. It's just basically a conduit. The stool is up higher.
Mhm.
When you go to the bathroom, you are sensing the stool in the rectum, and then you have your bowel movement, and then it leaves. But that location where we're having anal should not have stool if you're having the appropriate gut health. Now, for bigger toys and fists, that's a whole nother, that's a whole nother podcast that we can go into.
Yeah.
But for run-of-the-mill anal, that's what I would suggest.
Yeah.
So, Evan, just on that, obviously, you say you don't want us douching. I'm not going to do that. So, just I think from a mental point of view, I just wouldn't be able to get myself. And I imagine there's a lot of people like that who, even though you're a doctor and you're telling me that, doctors tell us not to smoke and we should drink less and so on.
Totally.
But people still do it. So you're a doctor and you're telling me that. But I don't think I could mentally get myself into the position where I'm almost brave enough to try without douching. So with that in mind, somebody like me who is going to douche anyway, is there anything I should pay attention to that maybe I don't know about?
So I think a couple of things to think about. One is, I like doing the toy stuff before sex, and even if you're preparing for sex, because it pre-dilates people, it opens you up, it pre-lubricates the space. And a lot of people do the toy test as a litmus test of how dirty they are. Because if they're putting the toy in and you come out and there's no stool in there, then maybe you in your mind can douche less. Because you're right. I started Future Method because I was meeting people where they are. They are going to douche. So how do we come up with a solution that is not toxic, that allows people to get clean and comfortable? So we started with our brand because of that. So our douche packets are these powder packets that you literally put the powder into 4 ounces of water. Why do you do that? Well, water or enemas really alter the microbiome. If you and I went down the streets of London, we could swab 10 random guys and you and I would know who takes it up the ass.
Okay.
And the reason is because the bacteria changes from anal sex, from douching with water, from using water-based lubes. And that anal microbiome that changes alters the microbiome, but leads to higher incidences of infections, STDs, HIV, higher incidences of anal trauma. So when you look at our brand, the powder packs neutralizes the drinkable water. So what it does is it allows you to feel sexy and silky, but doesn't fuck with the microbiome. Our bulbs that we use are much smaller because we know people are over douching. Now, some people use the shower hose. Some people are using really big bulbs. But think about run-of-the-mill anal. I only need this much, which is about, let's say, a foot, less than a foot, right, of controlled cleansing in this space. So I always talk about people that are over douching. They're like, oh, I douched twice. And I'm like, you know what, let me do one more time. And then that third time, they're now dirty again. And then they're spending 45 minutes in there cleaning.
Yes.
Well, what happens is we don't want you to elicit a bowel movement. We want you to just clean the actual rectal cavity. Many people are over douching, and what's happening is they're going way higher. They're going into the colon. And when that happens, your body senses the fluid, and through that, it now thinks you're having a bowel movement. So all the stool that would have never have come into play with run-of-the-mill anal sex now all of a sudden moves into the rectum, and now you have that much more cleaning that you need to do. So it's always less is more. I like the toys because even after you douche, it'll clean out any extra liquid that's there. it'll show you that you're clean. So a lot of people are using the devices to not only lubricate and open you up, but they're also using it as a test to make sure that you're cleaning. Because we know if you're going to douche, how do I just get you to feel comfortable to douche less? So if you're douching 5 times, go to 4 times. I bet you'll still be clean. Go to 3 times. Where are you on that so that you can bring your douching routines to the least amount? Because that will help you in the long run.
Because a lot of people, if you don't know this, when you're buying the instruments for douching, you could be like, oh, a shower one, that would be amazing. But it actually sounds like a shower douche is a horrible idea when you're talking about it.
It works really well. The problem is that it's like a colonic all the time. And if you're having 2 to 3 times of sex a week, you're really causing so much pressure. And remember, it's the rectum is a balloon.
Mhm.
If you fill that balloon further and further and further, there's lots of complications over time that can happen. Plus, you're basically shedding the lining of your insides that are there to protect you. So a lot of people that use the shower douches have a significant amount of mucus. They complain a lot of having extra mucus in the space. Again, they cause a lot of irritation internally. The problem is that about 5 centimeters inside someone's ass, they don't feel pain. You don't feel irritation. So many people that are doing this, they wouldn't know that they're causing trauma because they can't really sense it because there's no nerve endings above that to provide the pain sensation.
So, are there any shortcuts on mental preparation of how to let it go? Right?
That's tough because everybody's all over the place with that.
Mhm.
I think that we need to also like as tops out there, I'm sure there's tops listening, try not to shame people,
Yeah.
right? Because I think the shaming adds so much more to the fear and the stigma. Like we are engaging in anal play, and at some point in all of our lives, there will be a mess in
Yeah.
some capacity.
hmm
So I think we have to, as a group, put that to really to make sure that everybody's aware of that.
Yeah.
With that being said, though, I'm a huge toy advocate, and that toy advocate is the litmus test. Now, let's talk about my thought on toys. Most people are not having, especially with kids and families and lives, are not having sex 2 to 3 times a week.
hmm
They're not. We know that many people are. And so the reality is that if you're not having all of that sex, you need to bring toys into your life because people get hurt when they're not having routine sex all the time. When you're someone that bottoms every 2 to 3 months, many people get injury during that because it's a muscle, it's a system. You have to work the system. So I usually tell people if you're not having sex all the time, you should be doing toy stuff at least once a week. It'll help you with better bowel movement. It'll help you because we're all sitting, we're on Zooms all day. It'll help you just with allowing you relaxation in the pelvic floor and prostate health. And it'll allow you to really understand your body and keep it so that you can have sex. During those toy sessions, don't douche, evaluate your cleanliness, understand your anatomy, understand your body, and it starts to really allow you a little bit better understanding so that when you're ready to have sex, you can prepare less and or have more confidence because you've already understand your body.
Yeah. That's very interesting because usually we hear someone like people saying like to do less bottoming, and you're just saying right now that if you're not doing enough, you should actually do more. Is there some sort of signal that people should listen to of when it's too much or where it's not enough?
Well, I don't know what your definition of too much is. The male pelvis is so muscular. Are you saying because people feel as if, and that's a myth we talk a lot about in the book of I'm going to be too loose with bottoming? Is
Yeah,
that what you're getting at? Yeah,
exactly.
that doesn't pan out in run-of-the-mill anal sex. The male pelvis has so much muscle in that space.
Yeah.
So the reality is, where do I see laxity? Where do I see looseness? It's in fisting. It's in bigger toys. It's in trauma.
Yeah.
Run of the mill anal, no. I see it on the other side. Remember, we spoke of group 2 and group 3, people that have difficulty because their muscles are too tight. Those people need to be using it. Those people need to be dilating and opening. And I do a lot of work with anal Botox, which relaxes that third muscle. It lasts for about 3 months. Most people don't need it forever, but what it does is it gives you that relaxation so that you can bottom comfortably and start to really stretch the rubber band in a very controlled way. Because 75% of the world, 75% of bottoms can't bottom comfortably.
Mhm.
75%.
Wow.
So they're too tight. The mechanism of their pelvis is too tight. And so because of that, if you want to get into a good space where you're bottoming comfortably, you're bottoming more, and you're bottoming at will, you need to use it. And
Yeah.
you need to really start to dilate and get the mechanism to work for you.
Yeah.
So no, I don't agree with not bottoming routinely.
Yeah.
I think it's a matter of understanding all of those facets that play into it.
Yeah.
We can just touch on, you've mentioned Botox a few times. Somebody that I have sex with mentioned they are going to have Botox. I was horrified. I'd never heard of it before. And obviously you've explained how it works a little, but just explain to me as a layman,
Yeah.
the process of it. It sounds like this is going to be really painful and an absolutely horrible experience. Am I right? Am I wrong?
It shouldn't be. No, you're wrong. Yeah. I mean, I think realistically, of 15 years of me doing it, I've never not been able to do it in the office under no anesthesia. It's super well tolerated. Yes, it's 4 injections into the muscle in the ass through a small little camera. Yes, it's kind of like a vaccine, getting injected into you. That's what it feels like. But it's 4 injections. You do it in the office. There's no downtime. Most people don't work out that day that we're there, like legs and squats, but they go back the next day. It starts to work fully in a week, the Botox, and you don't shit on the street.
Because that's what's happening in my head.
Of course. Yeah, you're not. Remember, there's those 3 muscles. So the first 2 muscles, it's not where you give Botox. Those are still able to close and function. It's that third muscle. And think about people that are too loose, people that are in normal range, and people that are too tight. And we spoke of about 50 to 60% of people are usually in the too tight range. So by giving Botox, what you're doing is you're moving the pressure into the normal range for good anal sex. Now, if you can get your pressure into that range through toys alone, great, do that. But what happens is people are very apprehensive. When they feel pain, they contract their ass, they're getting tighter. And then all of a sudden, it doesn't allow them to bottom comfortably. So by giving Botox, what it does is it takes away that reflex. You're not too tight, and that reflex of contraction is gone because of the Botox. So now they can do toys, they can have better sex and feel more comfortable. And over 3 months, what it does is it resets the pressure. Most people need 2 to 3 sessions. So for every 3 to 4 months. So about 1 year of giving Botox. And then after that, they're having sex, they've reset the pressure, they're in a really, really good space to then allow them. And it's been a game changer because remember that group 3, they could never get to anal without doing an intervention that allows them to get into a good space. Remember, it's just a muscle. And if you are, one day we're doing biceps in the gym, the next day we're doing triceps to stretch the bicep. Well, nobody ever stretches their asshole. And think about 99.9% of the day, your ass is clenched and tight. So how do we really get it to work to allow you to get to average dick, big dick, toys, fists, whatever it is? It's a process. And now that you and the listeners have the understanding of anatomy and the process, you can start to figure out, well, where am I in that? and what can I do to get to where I want to be.
Amazing.
It makes me feel like exactly what you're saying, Evan. Tell me if I'm wrong, all right? Is that the tops don't exist, it's just they didn't learn how to take it.
That's a lot. It's so interesting you said that because in the office, when someone comes to me with an anal issue, I'm like, are you a top versus bottom? And we talk about their sexual nature of how they identify. And many tops, I say to them, are you a top because it's just not your MO? Or are you a top because it's painful, you've had bad experiences? And 99% of the time, it's that. It's
Exactly.
that. And I say to them, if I were to get you comfortable, if I were to get it pleasurable, would you bottom? And they're all like, absolutely, I would. So I agree with you. A lot of it is really early on educating and teaching and putting people into a space. And now through Bespoke, people have access to get there. If they're like mentally, I do want to take it, or I'm in a relationship where I do want to bottom,
Yeah,
how do I get there? Now we have solutions to get people there.
yeah.
Evan, I don't want you to make any more bottoms and get rid of any more tops. I'm against this. I'm totally against it. Stop.
I know it depends on what cities you're in
Yeah,
too,
okay.
right?
Just don't come to London.
Evan, I have a question. Is there a particular time of the day when you can lower risk of an accident if you are a bottom?
I think it's all about your routine of when you're having bowel movements.
Hmm.
So, also remember there's this gastrocolic reflex, which you probably know from the kids, which is when they eat, they then shit when they're younger, right? It's the same concept too. That's why a lot of people unfortunately starve themselves before bottoming or don't eat very much at all, because what happens is when they distend the stomach, it moves the stool to then create a bowel movement. So I think the issue for bottoming is like, you have to figure that out. When are you timing with your normal bowel movements? Most people have bowel movements in the morning, but if you're having two bowel movements, when's the second and when are you eating? And then that mechanism of understanding is what would set the stage for that specific person. I wish I had the magic answer or an x-ray to look in your ass and be like, hey, you're completely clean.
Yeah.
It's coming. We're working on it. Don't worry.
Yeah.
But with that being said, that's kind of the thought process that I would go through for the listeners.
Yeah, I guess it's that meme that always happens, isn't it? Where you always see with bottoms eating like 3 peas on a day and the top has a full plate of food.
Yeah.
Totally. And I don't want people to do that, right? Because that's not routine. I think it's, really understanding, like, if no offense to Chipotle, but if I have Chipotle, I'm not bottoming. Like, I'm going to be shitting all day. So you have to really kind of look at your habits, smaller meals, more protein, bulking agents, things to allow you to get into which is a lot of times, especially in our space, people that are doing that anyway because they want to put on muscle, they want to go to the gym, they want to do things, but it's just now thinking differently so that you can really attest to where you are and where your body is.
And let's get on to the big one, which is fiber. So as a doctor, what do you think bottom should be doing regarding fiber? Is it enough just to try and get it in your diet?
Yeah. So there are definitely people that are able to obtain it in their diet. It's a lot. And a lot of those people have a blessed gut that they're able to really create that equilibrium and positive. Many people just can't. So think of fiber, whatever fiber it is. I don't care. It's whatever it fits into your world. But think of fiber as a bell-shaped curve. So people take fiber and they're like, oh, the next day or 2 days, they're like, oh, it's not working. You can't do that. You have to take fiber, the same dose, the same time. You need to really do it for 2 to 3 weeks before you make a decision, because it takes time for your body to get into a routine. And also, you don't want to take it when you're taking other pills, because it fucks with the absorption, especially people that are on PrEP or other things. So you really want to try to take fiber alone, I like nighttime fiber because our bowel movements are really forming at night when we're sleeping. So I usually say before you go to bed, take some fiber, whether it's 2 pills, whether it's fiber packets, whether it's gummies, whatever that is. but think of that bell-shaped curve. So let's say you start to take 2 pills. It's working ish. It's not getting me fully. Great. Go to 4 pills and you'll slowly start to increase to get you. That's why a lot of people like the powder too, because they'll add it to like a protein shake or something and they'll put 1 scoop, then they'll put 2 scoops. But at some point, you're going to get to the top of the curve where the bowel movements are soft and formed. And in a way, kind of like how if you look like how a dog poops. A dog doesn't really, if they're eating the right diet, they don't need to wipe. That's the stool that we want, right? Because we know we're going to be cleaner. But at some point, you'll get to the other side where you're not taking enough water or you're taking too much fiber and it becomes much more constipating. So, where the listener is, where you are, you have to just go very slowly. And not all fiber is created equal. One fiber may do really well for you. Another one, you're like, oh, it doesn't really work well. But you have to kind of go along those steps to get you into a great space. And you also need to think of, well, what am I eating? Am I eating things that are high fatty foods or more oils that are pushing things? Sometimes people are drinking too much water, and water is creating a transit where they're now going much more with the fiber. So there's lots, it's so multifactorial, but I think it's a lot for people to grasp. But I think understanding the basic principles will allow people to start to implement. And don't make too many changes. Just make one change one time. Because if you make 2 changes at the same time, you're not going to know what is truly working.
Makes sense.
I've looked at your social media and there are few interesting topics that you are covering, which is tool size, whether it matters or not. If you could share, what were the key insights from this, I think the study that you've done, right?
Oh, yeah. We just came up with that. Yeah, totally. So, you know, we one of the things that I think is interesting is just more of like, obviously most guys overestimate their dick
Yep.
sizes, right? We know that, and it's usually estimated about 30% bigger than what they normally are.
Mm-hmm.
But we also looking at understanding the nature of like small dicks versus big dicks, and we know there's a difference in the bottoming of people getting injuries. So like when you look at smaller penises, what happens is it's going in and out. People thrust a lot more.
Mm-hmm.
So then what winds up happening is you get more injury from that because it's very pokey.
Yeah.
And every time it comes out, the muscle closes. And now the angles become quite difficult. So many people with smaller than average can have issues versus bigger. It's inside, it's staying there. The motion, the muscles are open, they're much more relaxed, and it's much more fluid in that space. So it's not to say that you can't engage, and it's not to shame anybody. It's to understand that if you are a top with a little bit below average, more lubrication, staying inside, not fully thrusting, being very gentle when you're entering and exiting because the muscles close with that. So there's lots that goes on to that.
That's amazing. It sounds like 5 great tips for tops that more than the bottoms.
Totally.
Any tips for maybe positions for tops
Yeah,
with below than average
totally.
size?
Yeah. So in the book, I do a lot of top tips. So where it kind of allows the tops to understand anatomy. I always say the best tops in the world are bottoms because they're able to
Of
actually
course.
understand the mechanisms of how to enter. But I am always thinking I would always start as a bottom on the top of them, sitting on them. So as a top, I would say lay down first, just get erect and let the bottom navigate your cock. You're looking at each other, you're seeing if you're grimacing, you're seeing if how it enters, you're able to communicate. You want to allow the bottom to enter and feel comfortable in that space, right?
On their own terms.
On their own terms. Yeah,
Yeah.
in control. I get it. Many tops just want to go to the, doggy style and fuck the shit out of somebody and have fun, which you can do. And I'm all for that. But the beginning stages is really understanding your bottom's anatomy, the person's anatomy, right? How do we get all those muscles to be lubricated? How do we get those muscles to open slowly and gradually? If you get right behind them and shove it in, you are going to create a lot of issues.
Mm-hmm.
So we want foreplay. We want people to lick and suck and have fun. We want people to use toys during play to get you into that good space. And then if you're starting, let the bottom control the beginning phases so that you can enter safely. And then you could slowly start to get to further positions. In the book, we label our positions as position like peaches, 1 peach, 2 peaches, and 3 peaches. From beginning, which is 1 peach, to more difficult positions like cowboy or standing positions where you're holding the bottom and you're going in those become really much more difficult, especially depending upon the extremes of smaller to bigger dick. So again, these are things that you need to think about, but it goes back to the basics of understanding anatomy. And if you understand anatomy and you understand how things open, you should be able to get into a really great space. And communication is key.
Yeah. Speaking of sizes, I think the question, and I think it relates to what you just said, is it myth that taking bigger dick is actually easier?
I think it depends. So we were talking about, definitely big dick, and depends on size, can be quite traumatic, especially if you're not used to it.
Yep.
So, the key with getting to bigger is how do you gradually progress to get there? The people that get hurt are the ones that go too fast into that. I think the average to bigger, from a sex position perspective, from a full penetration perspective, is easier if you're able to take it. Because what happens is it sits in the pocket, right? It's always sitting there, keeping the muscles open.
Yep.
People that are engaging with bigger, phallus, what they're doing is they're pulling out. They're not. They're leaving it in, and they're just creating friction. So again, I think it's really understanding the nature of that. If someone has a huge dick, whole different beast. It's more of, can you take that, go slow, gradually progress, all those things.
Yeah. It feels like the main insight from this episode for me is like, I don't know much and I need to learn more. Especially you highlighted several times that, we need to learn anatomy before going into this and making sure that everyone's comfortable. For our viewers and listeners, what would be your recommendation on, or where to get all of this information? Where is it easily available?
Yeah, for sure. So, all of my handles are kind of connected. So it's Dr. Evan Goldstein on Instagram, and The Future Method, or futuremethod.com, or Bespoke Surgical. So all of them have a lot of the education. I think the key for us is we just turned on international shipping on Future Method. It's easy. Obviously, now everything's calculated with taxes and tariffs and shipping and all of that type of stuff. And that was the impetus, which is, how do we push this to the rest of the world so that people have access to this type of care, these types of products, and more so, this type of education that allows people to really understand the ins and outs, literally, so that they can get to where they need to be. And if they can't get there, what are the things that we can do to get them and to really put that together? So that's really the amazing thing that we're doing from a sexual wellness perspective.
Brilliant. Evan, thank you so much. This was absolutely brilliant, educational, and entertaining at the same time.
I have like 40 notes here that I'm going to go and type up for myself. It was amazing. Thank you so much, Evan. And obviously, we'll put your handles and so on when we post this content, because I genuinely believe that people following you will be so helpful. And you also, just to clarify, you said you work with people remotely as well here in the UK and so on.
Totally.
Yes? Okay, fantastic.
Yeah, 100%. So I do a lot of Zooms. We kind of come up with a plan. And then if we need to see each other, we usually coordinate like a Thursday, Friday visit, seeing me in the office. A lot of people need surgery just because they're not taken care of from fissures or skin tags or hemorrhoids, or they've tried anal Botox and they're still not getting there. And so there's lots that could be done. But a lot of what I do, yes, on the educational side, is virtual first to set the stage and then see where people are.
Amazing. Evan, it's been an absolute pleasure. Thank you so much for coming on.
Thank you, guys. I appreciate it.
Evan, have a great day and thank you for your time.